Very good evening, all of you. So I hope my video as well as the audio is all clear. Just wait for a confirmation for a minute and then we'll start off. Okay. So welcome to this second class on Medet clinics in dermatology. So in the last session, we had discussed about various clinical signs in dermatology. And today what I intend to discuss with all of you is what should be your approach when it comes to vesiculo-bullous disorders. Okay, vesiculo-bullous diseases. So like all of you, when it comes to your postings in the dermatology clinic, you will be definitely coming across various various patients. So these patients would be coming to you with various presentations. Like some of them may present to you with a maculopapular rash. Some of you may present to you with a plaque lesion. Some of the patients may present to you with just vesicles, sometimes vesiculo-bullous disorders also. So in all these cases, what should be your right approach? Because in case you are someone who have not seen enough of dermatology cases, whenever you see a patient, you may get confused ki what a disease is this, what should be my approach, how do we reach out to a diagnosis? Because when it comes to other subjects like let us say medicine or in surgery, what happens is the patient is definitely coming to you. He's gonna tell you that I am having fever since the last 3 days, I'm coughing a lot, I'm having some breathing difficulty. So they are giving you enough clues. Whereas when it comes to dermatology, the biggest challenge is that the patient may come to you with a common complaint, most probably like itching or irritation, and they would say that I'm having all these lesions in my skin. Now, what should be your approach? The first thing when it comes to any of the vesiculo-bullous diseases, so I'll just highlight here the vesiculo-bullous. So now let's start with the basics now. First thing what you should understand is what is a vesicle and what is a bulla. Only then you will be able to understand, okay, this comes under vesiculo-bullous diseases, right? So now first let us begin with what is the basics called as what is called as a vesicle. So you must have learned about a vesicle. Sometimes you may commonly call it as a blister over the skin. Now, what do you mean by a vesicle or a blister? A vesicle is going to be a raised lesion. It is going to be a raised lesion which is going to be fluid filled. A raised lesion which is going to be fluid filled, and the diameter is going to be less than 0.5 centimeter. So diameter less than 0.5 centimeter. This is what we call as a vesicle or a blister. Okay? So anytime you see a patient who is having this kind of a raised lesion, and the moment you see that acha, there is some fluid or some water beneath this lesion, then you call it as a vesicle. I'm just zooming it for you for your understanding. So this is going to be vesicle. So patient can come to you with multiple vesicles. Sometimes these vesicles are localized to a certain part of the skin. Sometimes these vesicles can be generalized throughout the skin. So all these presentations are possible. So before I move forward, let me give you an example. In case you are having an allergy to a wristwatch. So when you have a allergy to a wristwatch, you may develop something called as a contact dermatitis. So once you develop a contact dermatitis, where will you get the lesions? You may get some vesicular lesions, some oozing lesions at the site of contact. वो हो गया localized type. Whereas, is there any common example that comes to your mind when it comes to a generalized vesiculo-bullous eruption or a vesicular eruption? Generalized vesicular eruption, where a lot of vesicles will be there over the body. Okay, the clue is going to be it is an infection, and that is going to be varicella or chicken pox, isn't it? So in chicken pox also you can get multiple vesicles throughout the trunk. So this is for your understanding. Now moving forward, let us try to differentiate about what is going to be bulla, because I'm talking about vesiculo-bullous. So now let's see how does a bulla look like. So I'll just zoom this image for you. Now, when you see this image, what is the obvious difference that comes to your mind now? So when you just observe this image, so what is the main difference that you can appreciate? So here, this one, which I'm gonna call it as a bulla. So here, the main difference that you can find here is that the diameter is not less than 0.5 centimeter, whereas the diameter is going to be more than 0.5 centimeter. Now, don't get confused about this diameter wala part. The reason is, when you go through various textbooks, some textbooks mention as zero point 0.5 centimeter as the standard, and some textbooks mention as 1 centimeter as a standard. So when it comes to your university level exams, or when it comes to your MCQ practice, in every places, just keep either 1 centimeter or 0.5 centimeter as your base. So less than 1 centimeter or less than 0.5 centimeter, vesicle. More than 1 centimeter or more than 0.5 centimeter is always a bulla. So what is this? This is also a raised lesion. So this one is also a raised lesion, and this is also a fluid filled lesion. Now it is very, very important that you understand these basic concept that we are talking about a vesicle. A vesicle is less than 0.5 centimeter and a bulla is going to be more than 0.5 centimeter. Both are going to be filled with fluids. Now let us come back. Now what you have to do here is, we are talking about med clinics here. So when we talk about med clinics, now you have to imagine that you are the doctor and you are going to see a lot of dermatology cases today. Now you are the doctor now and you are getting a patient. So whenever a patient comes to you with a vesicle or a bulla over the skin, so what should be your approach is what we are discussing now. So first of all, let us see what are the common differentials. Now, when it comes to the common differentials, what you should understand is, what are the common diseases where you can find either a vesicle or a bulla? So that is the first and the most important thing that you should understand. So this can be either ये एक autoimmune disease हो सकता है, या फिर ये एक infection हो सकता है, isn't it? Sometimes it can be a genetic thing, or it can be some inflammatory or eczematous. Now let us say autoimmune. So when you do your theory, you have learned about a lot of autoimmune diseases where you can find a bullous lesion or a vesiculo-bullous lesion over the skin. So if anybody could answer, in which autoimmune disease in dermatology can you find vesiculo-bullous lesions over the skin? So if you can answer, that would be great, because autoimmune disease, autoimmune diseases means, some of the examples can be pemphigus group of diseases. So pemphigus group of diseases in the way, pemphigus vulgaris, pemphigus foliaceus, IgA pemphigus. So all these things comes under the pemphigus group of diseases. Now the second one is infections. Now in which of the infections can you find vesiculo-bullous diseases? Abhi I gave you an example, है ना? So a child who can come to you with a lot of vesicles over the body. So this can be infections like chicken pox. So chicken pox or varicella. Chicken pox or varicella. So in this disease, in this infection also you can find, another example can be HSV, matlab herpes simplex virus infection. So in all those infections also you can have a patient who has a vesiculo-bullous lesions over the trunk. So in genetic, again, there are some diseases, just say Darius disease, Haley disease, all those are inherited diseases. And otherwise in genetic, it also comes like epidermolysis bullosa. So that is one of the example. And the last one is where you get inflammatory or eczematous causes. काफी सारे eczema होते हैं ना? So it can be because of contact dermatitis, allergic contact dermatitis, irritant contact dermatitis, so a pemphigus. So all these are different types of eczemas or allergy where you can get. So let me just write it down as contact dermatitis. Now what did I do here right now is, I just made a differential diagnosis based on the etiology. But when we go in this approach, see how many diseases will you remember? That's a very long list of diseases that we have to remember when a patient will have a vesicle or a bulla over the trunk. Now, rather than that, even if you know all these things, what I want you to remember is, you are seeing a patient with vesiculo-bullous disease. think that ये एक autoimmune disease हो सकता है, ये एक infection भी हो सकता है. It can be a genetic disease or it can be some eczematous or an inflammatory disorder. So this is based on the etiology. Now let us cut it down easily. Like let us try to always keep the age as a differentiating factor. Okay, that becomes a little, make it little more easier. So now let us go according to the age. So abhi what we are going to do is age based approach में जाएंगे. Like a patient is having a vesiculo-bullous lesion. Now the age of the patient is a newborn, is a neonate, or is a infant. So when it comes to a neonate or an infant, then what do you do is, what are the diseases that should come to your mind? So is there any disease that you have learned probably in pediatrics, because in neonatology, or in infancy where you get a vesiculo-bullous lesion? So hi Kalai, hope you're keeping fine. So now let's see, can you try to give me few of the examples where a neonate or an infant can develop vesicles or bulla in the trunk? I'll just give you a few of the examples now. So one example is, I'll give you a clue. This is a disease which is actually sexually transmitted, and a mother, if she is not treated, she can pass on this infection to the child. And usually this is a disease where the adult usually develops a genital ulcer disease, where the genital ulcer is also painless. So these are the clues for you. So this disease where a neonate can present to you is called as congenital syphilis. So in congenital syphilis, a child can present to you with vesiculo-bullous lesions. And especially you can find these kind of vesiculo-bullous lesions. Kahan pe? You can see it over the palms and soles. So that is one. Another disease, the moment I say palms and soles, where you find vesicles and bulla, there is one more disease where you can find vesiculo-bullous lesion over the palms and soles in a child or an infant. So this is called as infantile scabies. So this is called as infantile scabies. Now, what are the, you're very good. It's not neonatal varicella, but you're very close. This one, what you are answering it as Kalai, I would say that neonatal herpes is possible. Okay, neonatal herpes. So neonatal herpes simplex. Okay, neonatal herpes simplex is a good possibility. Excellent. Very good thinking. Now, all these things are possible when it comes to a neonate or a infant. And can we also discuss about some of the infections? Abhi ek infection ho gaya neonatal herpes simplex. And is there anything else where a child who got an infection because of staphylococcus was not treated properly? Now, what happens if you don't treat a child who got an infection is that the staphylococcus may enter into the bloodstream. It can release toxins into the blood. The toxins can be exfolia toxin A, it can be exfolia toxin B. So I'm just waiting for the answer in the chat box. So exfolia toxin A and B. These toxins, what do? Is they will go and attack the desmogleins. And because of that, the child may present to you with massive erosions. See, bulla may develop over the trunk. This bulla would rupture and there would be a lot of erosions. So this one is called as 4S. So what is the full form of a 4S? So 4S means this is staphylococcal scalded skin syndrome. So this is staphylococcal scalded skin syndrome. So all these things can be in your mind when it comes to a neonate or a infant. Now let us think about a child, okay, a 4-year-old child aa gaya, ya fir 5-year-old child. So when a 4 or 5-year-old child comes to you and you see something like this, so I'm just moving it. Excellent, Kalai, your answer is right. So now let us think about a child. So I think when it comes to a child, we can easily cut it down. It is very easy. Kyunki if there is a child who presents to you, like a child is having, now the history is like, the child had a fever 2 to 3 days ago. And after this fever, the child has developed these kind of vesicles over the trunk. And when you examine, these vesicles looks very beautiful. Why do I say it looks very beautiful? Because it looks something like this, where there is some red background and there is a vesicle over the top. So this is compared to a dewdrop on a rose petal appearance. Is compared to a dewdrop on a rose petal appearance. Now, what is this disease? So this disease is going to be chickenpox. So this is chickenpox. So a child with a history of fever comes to you with generalized vesicular rash. Think about chickenpox. The moment you see one good vesicle which looks like a dewdrop on a rose petal appearance. It's very important. It's a very common question. A dewdrop on a rose petal appearance, it is seen in chickenpox or a varicella infection. Now I'll just move to the next image now. This is also another possibility where a child may present to you with multiple vesicles या फिर bulla, and these vesicles or bullae, they may again erode, giving a crusting. So in such cases, what is the diagnosis? Where do you get this golden yellow honey colored crust? So here, this one, it should be impetigo. So are you able to visualize, or are you able to imagine? Yeah, I'm getting a child in my OPD, and when I'm getting a child in the OPD who is having a generalized rash, then I'm thinking about a chicken pox. Whereas when I'm seeing a bullous lesion which is having some crusting. So what do you mean by crusting? Crusting means any exudate which may get dried up over the skin. Okay, if I had a trauma and if I had a small abrasion here, and if the blood is getting dried up over the skin, it's called crusting. If there is a pustule where this opens up and the pus gets dried up over the skin, it's called crusting. If there is a vesicle, it contains a clear fluid, and this vesicle ruptures and this water or a liquid, it is going to dry up over the skin. It's called crust. So what is the color of the crust here? The color of the crust is yellow. That is why the textbooks call this as golden yellow honey colored crust, and the diagnosis is going to be impetigo. Is that clear? Chalo. So now after these neonates, after infants and children, now let's move into adults. So when it comes to adults, there can be a lot of reasons why an adult may develop a vesiculo-bullous lesion. Now, what are the common causes of vesiculo-bullous lesions in adults? First of all, always when you find a vesiculo-bullous lesion in adults, think about autoimmune diseases. So think about autoimmune diseases. So what are the autoimmune disease? Because on the start of this lecture, I had given you few examples where autoimmune diseases can be seen. For example, it can be pemphigus group of diseases. So this is pemphigus group of diseases where you can find this multiple bulla over the trunk, and these bullae may also rupture. So if I just zoom this image for you, this would have been a patient who had a bulla here, a bulla here, a bulla here, isn't it? So what has happened is, over the course of the disease, this bulla has got ruptured, and then this bulla has also got ruptured. This has also ruptured. So once these bulla would rupture, what happens? There is something called as erosion. So what is erosion? A partial loss of epidermis. Simple. Okay, there is a bulla, the bulla ruptures, and there is a eroded skin. There is a eroded skin. So what are the other example? Other than pemphigus group of diseases, there can be a disease where you get a tense bulla. It's called as bullous pemphigoid. So you can find them in bullous pemphigoid also. So adult pemphigus vulgaris, bullous pemphigoid. Keep these two things in mind. Sometimes what happens, some severe drug reactions or drug allergies can also lead to a patient developing multiple bulla over the trunk. Let us say an example. Here a patient has taken a commonly prescribed antibiotic like amoxicillin. Now, after consuming amoxicillin, the patient suddenly started getting a lot of bulla over the body, and these bulla started getting eroded, and he's having a massive peeling of the skin. So when you see the patient, it looks like a burns patient. Now that is a very, very severe type of a drug eruption. And in such cases, these drug eruptions, you call it as Steven-Johnson syndrome, Steven-Johnson syndrome, or toxic epidermal necrolysis. Steven-Johnson syndrome or toxic epidermal necrolysis. So these are some of the cases where you can get a vesiculo-bullous lesions. And of course, when you think about inflammatory or eczematous lesions, this can be due to contact dermatitis or other eczema. The contact dermatitis or other eczema. So all these are going to be your differential diagnosis. So what is very important to remember is, it is much more easy to remember it in this way according to me, because if you try to remember it in a age-based approach, and you can narrow down your differential diagnosis, because here I'm not telling about congenital syphilis. Here I'm not telling about anything else. So all these things in adults, in infections, we have not mentioned about infections here. So we will also mention about some of the infections that you can see in adults. For example, it can be herpes simplex virus, isn't it? Herpes zoster, etc. Herpes zoster, etc. So in all these cases, you can find vesiculo-bullous lesions. Okay, in some of these diseases, you can mostly find vesicles. Some diseases you mostly find bulla, but together we call it vesiculo-bullous. So now let's move into elderly. So whom do I call it as elderly? Because we have already discussed about adults, but when it comes to your college exams, or when it comes to any MCQs and all, if there is a mention that the age is more than 60 years of age, so in elderly patients, what is going to be more common is something called as bullous pemphigoid. Because in the OPD, the moment we find an elderly patient who is coming to you with tense bulla over the trunk, as a tense bulla. So these are the bulla which may not break very easily. So in all those cases, what we find is a tense bulla which is not likely to break so easily. In such cases, the spot diagnosis, or immediately you can reach out to a diagnosis, which is going to be bullous pemphigoid. It is going to be bullous pemphigoid. So in this chapter of vesiculo-bullous diseases, there are a lot of diseases. Let us say dermatitis, herpetiformis, and different types of eczema called as pemphigus, etc. But the intention of this lecture is, like, we are thinking completely clinical oriented. So we are trying to imagine a patient who is coming to you with these kind of lesions, and we are trying to cut down the differential diagnosis based on the age. Clear? So in all these cases, is there any investigations that we can do when it comes to a vesiculo-bullous disease? Like, you got a patient who is having chicken pox. You got a patient who you suspect is going to have a herpes simplex virus, or you got a patient whom you think at it may be it may be pemphigus vulgaris or bullous pemphigoid. So in all those things, can we have a general approach about how can we do a workup with the investigations? Obviously, in all of the patients, just like how you deal it in medicine, we can go for a general workup first. General workup first. So in the under the general workup, or what are the things that you can do? You can obviously go for a complete blood count. Okay, you can go for a CBC. You can also go for a LFT as well as a RFT. Okay, CBC, LFT, RFT, all these things can be done. Now, I want you to go more specific, because based on a CBC or a LFT, there is rather very few inference that we can draw. Now, how can we go on a very specific approaches? There are some specific investigations which is done when in the cases of vesiculo-bullous disease. So now let us see what are the specific investigation, the specific test. Now this is the image. Yeah, excellent. I'm so happy to see this answer. So already I got the answer in the chat box. So this is called as the Zank So this is called as Zang smear. So when you do a Zang smear, so what do you mean by a Zang smear? Is imagine that I am having a vesicle here over my face. I'm gonna de-roof this vesicle. Okay. So you can either de-roof it and you're gonna de-roof this vesicle and you're gonna take out the contents of this vesicle in a glass slide. You apply a GMSA stain and then you're going to examine under the microscope. So this is called as the Zang smear. So every time, please keep it in mind, you get a patient who is having a Vesiculo-Bullous disease. One of the investigations which you can do is a Zang smear. So once you do a Zang smear, there are two options. Like either you can find something like this. So what is this finding? Probably if you know, I can give you a minute to guess. So what is this finding? You can see multiple things together. So this is something which is called as, starts with M. Can you give it a try? So this is called MNG cells. So what do you mean by MNG cells? MNG cells means this is multi-nucleated giant cells. So this is multi-nucleated giant cells. Now, why does this investigation become important? Is because multi-nucleated giant cells can be seen in some of the infections like herpes simplex virus infection as well as in varicella infections. So yeah, excellent. So very good guess. So this is going to be multinucleated giant cells. Now that you know about multinucleated giant cells, let me ask you, what do you see in the right side of this image? So this image. So in this image, you can see there are multiple rounded cells with a very large nucleus. So is there a name for this kind of a cell? So here what you can find, you can see these kind of rounded cells and you can see that the nucleus is also pretty big. So rounded cells with a very large nucleus. Now this is actually a confirmative thing. The moment you see this, you will be able to reach out to a single diagnosis or a group of disease. Now what is this? This is called as acantholytic cells. Acantholytic cells or Zang cells, and this is seen in pemphigus group of diseases. So this is seen in pemphigus group of diseases. Yes, so this is going to be acantholytic cells. So now it makes sense. So whenever you find a patient who is having a vesiculo-bullous lesions over the trunk, so it makes sense to send this patient to do a Zang smear. Because once you do a Zang smear, you will get the result like the patient is having some multinucleated giant cell. So you narrow down your diagnosis into some infections like varicella or HSV. Whereas when you see something like this, where the patient is developing rounded cells with a large nucleus, then you start thinking about pemphigus group of diseases because these are acantholytic cells or Zang cells. Clear? So now let's move further. Now another very important investigation when it comes to Vesiculo-Bullous disease, especially pemphigus vulgaris, pemphigus foliaceus, bullous pemphigoid, etc. So this investigation is called as the DIF. So what is the full form of a DIF? So DIF means direct immunofluorescence. So this is called as a direct immunofluorescence. So what is happening in a direct immunofluorescence is that we are taking a perilesional skin and we are going to examine this under the microscope with the for the fluorescence. Okay, so for the fluorescence, what is it? You can see that some part of this image is having much of a greenish discoloration, isn't it? All this entire part has taken up greenish fluorescence. So this kind of an appearance that you can see in this image, we call it as a chicken wire pattern or a fishnet pattern. So based on this investigation, we can differentiate whether this is going to be pemphigus vulgaris or bullous pemphigoid, and several other vesiculo-bullous diseases. Like, what happens is whenever there is a etiology within the epidermis will take up the fluorescence. So when we know that, okay, which are the diseases where there is a etiology lies in the epidermis, like pemphigus foliaceus, pemphigus vulgaris, IgA pemphigus, etc. All these things is going to have this greenish fluorescence over the epidermis. Whereas if the dermoepidermal junction or subepidermal region will take up the fluorescence, then the answer varies accordingly. Okay, like in the cases of bullous pemphigoid, you can see that there is a greenish fluorescence over the dermoepidermal junction. So that is how you can differentiate. So I just wanted to give you these basics today. Yeah, Fishnet Pattern, Kalei is answering pemphigus vulgaris, pemphigus vegetans. Yes, pemphigus foliaceus is also Kalei. So all these diseases we can get this Fishnet pattern. Okay, so that is how it is, the general approach of vesiculo-bullous diseases. And finally, when it comes to the management, see, management again, it completely depends upon your final diagnosis, because we got a patient who had either a localized lesion or a generalized lesion. And then we also kept few things in our mind, that it can be a autoimmune disease, or it can be genetic, or it can be infections, or it can be inflammatory or eczema. So these four categories we kept in our mind. And then we tried to analyze according to the age of the patients what is more likely. And then after making those kind of differential diagnosis in our mind, we send the patient for some investigations. And after doing these investigations like Zhang smear, we were able to again narrow down on the diagnosis. Or when you do an investigation like DIF, you are able to reach out to a conclusion. Obviously, there are other investigations also which you can do. For example, if you want to take an ultimate confirmation, you can also go for a skin biopsy as well. So all these different investigations can also be done. Okay, like for example, I said that there is a possibility that it can be congenital syphilis, isn't it? Or so in such cases, we'll have to go for syphilis serology. Again, serological investigations. Or I have also mentioned that there is a chance that a child is having scabies. So in such cases, we can go for a scraping over the lesion. So according to the patient, you will be approaching it, you will be planning your investigations. And finally, when it comes to the management, what we are going to do is, there are some general principles here. Like, we are going to take care of the wound, because every time a bulla would rupture, you are the patient is more prone to getting a secondary infection as well. So it is very important that you give adequate infection prevention and a good wound care. And of course, we have to go for therapy according to the etiology, because based on the diagnosis, you go for the treatment, right? So what are the different scenarios here? In case the patient is having some infectious conditions like chickenpox, HSV, varicella, herpes zoster, in all those cases, you'll have to go for antivirals. If it is impetigo, which is caused due to either staphylococcus or streptococcus, so we have to go for antibiotics. Whereas in autoimmune diseases, where our body is attacking our own cells, so in those cases, we have to go for immunosuppressants, or the commonly used ones are going to be corticosteroids or other immunosuppressants like azathioprine, mycophenolate, cyclosporin, etc. Okay, and if it is eczema, okay, whenever you find that if this patient has developed these vesicular lesions and oozing because of contact dermatitis or any other causes of eczema, then eczema is usually treated again with topical steroids, steroid creams, ointments and all. Along with that, since it is eczema, the patient would be having a lot of itching as well. So in such cases, you can also go for antihistamines. So the basic thing that we have done in today's session is, I just wanted to give you an overview. Okay, so there is nothing to be scared of when you see these cases in dermatology, that how do I reach out to a diagnosis. Like, the best methodology that you can always take up while you see dermatology patient is that first thing, even before you take the history of the patient, try to describe what is a primary skin lesion. Both vesicle and bulla is a primary skin lesion. The moment you see that this is a primary skin lesion, whatever we have discussed today and much more extensive list will come to you as a differential diagnosis, and then you can go it accordingly and go about it accordingly. Okay. So that is all about today's session, and please make sure that, like I explained to you in the last class also, we have added a lot of cases in the app where there are specific mention about what is the kind of history you have to take in when it comes to acne vulgaris, how are you going to treat these cases, how are you going to approach a patient of vitiligo, scabies, tinea. So all these things are there. So as we get it started, we will have more and more sessions on Meded clinics. And along with that, please go through these features in the app so that it helps you during your clinical postings or ward postings during your medicine. Okay. So thank you so much for watching, and we would be connecting again more with more such lectures. Thank you so much.